Doctor, thanks very much for joining us today. Our topic is headaches, something we all experience. Just for clinical definition, what exactly is a headache?
Headache is actually a term that's used to describe pain. Usually it's pain that's in the head, face, or neck area.
Is there any such thing as a common headache?
There actually is. Most of the time when people are talking about a common headache, they're actually mainly talking about a tension headache, which is probably the most common headache that we have.
Well, what is a tension headache?
A tension headache is usually described as pain that people have. It's usually bilateral. It usually starts at the back of the neck. It can be forward, and people can have it in their forehead area as well. Some people will also have it into their temples. It's usually associated with it's like a tight band most of the time, and it can be associated with some nausea, and usually not vomiting though.
Tension headache we just defined. Are there other different types of headaches?
There are. Actually, when we talk about headaches, there's probably three primary headaches that we talk about, and those are tension headaches, migraine headaches, and cluster headaches.
And let's talk about tension headache just a little bit more. What can I do to avoid a tension headache?
A lot of times tension headaches are caused by life stressors, usually just the hustle and bustle of your day and, being stressed at work. Sometimes it can also be caused by arthritis in your neck, those kind of things. Probably getting enough sleep at night, exercise, those kind of things, biofeedback techniques that you can do to help you relax, those kind of things can help you avoid tension headaches.
If you treat a headache with medication, what's the self-treat, something over the counter, what's the best thing to use? Ibuprofen, Tylenol, aspirin? When do you use what?
Actually, all of those things treat tension headaches very well. Aspirin is also a blood thinner, so it's not the first thing I recommend usually for tension headaches. Extra strength Tylenol or Tylenol is a good medication for tension headaches. Ibuprofen is as well. For ibuprofen, if you're going to use it for a headache, it's not recommended that you use it more than about 10 days at a time. So if you're having daily headaches or something like that, you may want to use Tylenol instead.
I understand. There are people who say they have a migraine headache, in which they may or may not. So, for purposes of this discussion, let's define a migraine headache.
A migraine headache, in comparison, I guess, to a tension headache, is usually just on one side of the head. A lot of times people will have it in their orbital area or in their eye. Usually with migraine headaches, people might be more sensitive to sound, may be more sensitive to light. It's usually a severe headache. It may actually interfere with your activities kind of thing. It is also associated with nausea, and sometimes people will get vomiting with it. Some people have an aura where they kind of get some kind of warning ahead of time, usually a feeling that they have that they're going to have a migraine headache. And usually migraine headaches can last anywhere from 4 hours to really a couple of days.
How do you treat a migraine headache?
There are two ways to treat migraine headaches. We kind of look at the acute component of a migraine headache, and acutely, you're just trying to get rid of the headaches. And so a lot of times we can use pain medications for it. Usually, if a person's having a pretty bad migraine, you may have to use a narcotic, like a hydrocodone, a Vicodin, or tramadol, something like that. Mainly, we like to use a medication group called triptans, and they're really specific for migraine headaches, and that's medications like Imitrex or Maxalt or Zomig. So that's how we treat the acute component of a migraine headache. The chronic component of a migraine headache is sometimes people will have headaches. Some people have them daily, or they may have headache for 3 or 4 days at a time. They may notice that they're having headaches, 3 to 4 times a week. For that, we try to use medications for prevention, and there's a lot of different medications that people use for prevention. It can be anything from an antidepressant to a blood pressure medication to a seizure medication.
You mentioned one other type of headache, cluster headache.
Yes.
What is that?
A cluster headache is usually very similar to a migraine in that it's only on one side of your head, but it's a very severe headache. I mean, it can be debilitating. A lot of people, when they're having a cluster headache, it's hard for them to sit in one area. The headache can be so bad. Usually a cluster headache will last anywhere from maybe just 15 minutes to 45 minutes, maybe an hour. They don't tend to last long. People may get them for a couple of weeks or months at a time, and then they may go away completely, and they may not have them for a while, and then they'll come back maybe in that same season the next year and be the same way.
I think my headache's an allergy headache or a tension headache. I think I have, kind of the garden variety headache. At what point do I become concerned that it's beyond a garden variety headache and requires professional intervention?
If you felt like it was the worst headache you've ever had in your life, that's usually a sign that you probably need to seek some kind of medical attention for it. If you have headache and it's also been associated with loss of consciousness, or you're having dizziness with it, if you're having soreness in your temples, or also if it's a new onset, if you're someone who's not always had headaches and then you have a real severe headache, you might want to get treatment, or you may want to consult a doctor to just make sure that it's not anything but migraines or something like that.
Very well. Thank you very much for your time, doctor.
Oh, I've enjoyed it. Thank you so much as well.